Ok, então boa tarde para todo mundo que vai estar nos assistindo. É com muita gratidão que a gente está indo para o final dessa tarde juntos, falando sobre prática em coaching, com a presença da Liane, que é diretora executiva do National Board for Health Wellness Coaches, está oferecendo o tempo dela para nós aqui muito generosamente. Thank you, Liane. E a gente também vai falar com o Michael Arlowski, né, que tem uma escola incrível de formação de coaches nos Estados Unidos, que é a Real Balance. E a gente também agradece generosamente a presença do Michael aqui. Thank you, Michael.
So we are moving towards the end of this rich afternoon together discussing coaching, and we are very honored to have with us Leanne Webster, Director of the National Board for Health and Wellness Coaches, and Michael Orlowski, CEO and founder of Real Balance, a school that has formed thousands of health coaches in the US. And it's a pleasure to have you here to talk to us about health coaching.
Well, thank you very much. It's our pleasure as well.
Yes, thank you so much.
So we'd like to start by asking you both, in whichever order you prefer, to tell us about the scenario of health coaching in the US and elsewhere. What's going on?
Sure. I can go ahead and start. So what we've seen over the course of the last decade is a growth in the profession of health and wellness coaching. We recently just figured out we have 41, well, we didn't figure out, but we have 4,100 National Board Certified Health and Wellness Coaches. And what we realized is that we now have coaching represented in every state across America and in 26 countries throughout the world. So we're definitely seeing a growth in the profession, and we're seeing a lot of awareness around health and wellness coaching, and we're receiving a lot of inquiries, and just overall, I would say there's a lot of interest right now in the field.
And what Leanne is speaking to is numbers around people that are actually certified by the National Board. The number of people that are doing health and wellness coaching is far greater than that. And we're finding, an adoption by disease management companies, insurance companies, employee assistance programs, and of course, corporate wellness programs, where they're realizing that they have to do more than educate. They really have to provide people that can work in groups and with individuals to help them really succeed at lasting lifestyle change.
It seems you have a growing market, and for sure a more mature market that we are in Brazil. So can you talk about a little about the challenges you faced and some strategies that you use it to overcome the challenge for this health and wellness coaches?
Sure. I think one of the biggest challenges that we face is a lack of understanding around what is a health and wellness coach and what can they do for you. So a lot of times what we're seeing is that the term health and wellness coach is confused with other terms that you might see. So a certified personal trainer, or an athletic trainer, or a nutritionist, or a dietitian. There's a lot of confusion around the term health and wellness coaching. So I think one of our biggest challenges actually is to educate the market, right? So we have to educate the public, and we need to educate people employers, so people who hire health and wellness coaches. And then we also have a lot of education to do in healthcare systems, right? So that physicians and anyone on the healthcare team really understands the role of a health and wellness coach and what a health and wellness coach can do for their patients. So that's our biggest challenge, and we need to do more outreach and marketing to reach that goal.
Yeah, one of the reasons that myself and some very amazing colleagues formed the National Board for Health and Wellness Coaching was just what Leanne is talking about. You see, coaching is not a licensed profession where we are not providing treatment. So therefore, government does not regulate coaching. We are considered consultants or even education. But the result is that anyone can call themselves a coach. Anyone can call themselves a health coach or a wellness coach, and they do. So because of that, we needed to form a really independent body that could certify that people actually have trained in what we have determined are the core components of what we would call real coaching. That way, at least people who become certified, we know that they are trained well, that there's real credibility there. And that way, the public starts to get a better idea of what coaching really is. And the consumers, like we're talking about in healthcare or insurance companies or disease management or whatever, so that when they hire a coach, they are looking for someone with really good approved training, where there's a consensus about the validity of the work that they're doing and the reliability of how they will perform on the job. Mm-hmm.
Yep.
Excellent. So that touches on the yet largest challenge we do have in Brazil, which is we are starting the path, as you probably did 10 or more years ago. Mm-hmm. And so there are solid formation courses, yet we do have to clearly differentiate ourselves from the people who call themselves coaches with or without training or with a weekend training. And yet, on top of that, get the health professionals to believe and eventually hire health coaches. So maybe you can tell us a bit of what was done in the beginning to get health professionals to buy this credibility, besides putting together the national board, which of course is a milestone.
Well, let me just speak to that, and then Leanne can definitely add to it. I think one of your other presentations of the symposium addresses the importance of the scientific research that has gone into showing that health and wellness coaching does have an evidence base. And like any new profession, when we started over 20 years ago, really, it was a new profession. We didn't have that. The studies weren't there yet. The early studies sometimes would be about nurses doing health education, and they would call it coaching. The key was to integrate the International Coach Federation core competencies into coaching and what health and wellness coaching was, so that there was a little more of a consensus that this is actually real coaching that is being done. And when there's studies that are being done that way, we know we're comparing, we like to say we're comparing oranges with oranges or apples with apples instead of two different things. You can't compare a coaching study with an education study, for example. So once we had that evidential base, then there was more openness among people in the healthcare field to look for how there could be value in a behavioral change expert helping someone to actually succeed at the lifestyle changes that the treatment team wanted to see the person succeed at. Mm-hmm.
Yeah, and I think to add to that, we still have a long way to go in terms of integrating the health and wellness coach onto the healthcare team, but we're actively working on that. But one of the conversation topics that we often will address when we're trying to show the validity of health and wellness coaching is we can go back to the fact that we performed what's called a job task analysis for the industry, right? So that's when you identify the knowledge, tasks, and skills that someone in a given profession should have. And so we did this, and then we had it validated by approximately 1,000 people who were already practicing in the field. So we brought in the expert voice to really take a look at what we had done. And so I think that the fact that we took those steps, it has a lot of validity when we're talking to a healthcare practitioner about, what we've accomplished so far and why it is in fact important to integrate a health and wellness coach onto the healthcare team. So I think as Brazil is growing the field, it's important to really be able to take a look back and say, hey, we did this to move forward.
Yeah, it's amazing to listen to you and to be in this coaching field for 10 years now. I did my certification in 2010, so I'm trying to move forward with coaching in Brazil for a while now. And when I listen to you, Michael, I remember talking about the ICF skills and competences and how this was integrated and adapted for the health coaching. So I can you talk a little about how can we let me formulate the right question. How can we tell people what is the difference from an ICF coach well trained to work with executive coaching and other fields of coaching, and a health and wellness coach? Mm-hmm. So people understand the specificity of the field.
Yeah, that was an important question that we looked at when we formed the national board that Leanne is now the director of. We saw a need for other competencies to be covered that a health and wellness coach needs to have that a business or executive or leadership coach would not have. The reality is a lot of the work that a health and wellness coach does is helping people to change a lot of daily habit type behaviors, lifestyle behaviors, the kinds of behaviors that people have been doing for many, many years, and usually know that they want to improve, but often don't know how. And so, we've seen, and I'm sure you have seen too, people struggle for years with diets, with smoking cessation, products, one thing and another, and not really have much success. So what we saw was that the kind of skills that were needed for a coach were more than the more general type of skills that a business or executive coach would have. There's a lot of similarities. There's a lot of overlap. I like to say that health and wellness coaching is a type of life coaching, but it really is more of a specialization that does require knowledge and skills for what is healthy lifestyle, what are agreed upon, validated resources for what is a healthy lifestyle, so that we're not just giving opinions, we're really pointing people in the right direction, and then we're really helping them to change these daily habits that are going to help them be more healthy and well. Yeah. Any other distinctions there, Leanne? Yeah.
Yeah, I mean, to add to that, I think that especially when, there are a lot of coaches who choose to be entrepreneurs, right? So they're working with the general public, and it's not necessarily a referral from a physician. And there are also coaches who are part of a healthcare team. And so it is really important that if you're working in healthcare, or if you're working with someone who wants to live a healthier life, you have to understand some basic healthy lifestyle terms, right? So, what is cholesterol? What is diabetes? What is blood pressure? So the health and wellness coaches do have a knowledge of that so that they can have the conversations. They're not necessarily directional conversations, but they are coming to the table with an understanding about living a healthy lifestyle.
Yeah, a good example from what Leanne just said would be the fact that coaches, health and wellness coaches, very frequently work with people that already have some form of chronic illness, heart disease, diabetes, COPD, things like that. And let's say, for example, like Leanne was saying, she brought up diabetes. The health and wellness coach needs to speak the same language as their client. They need to understand what their client does to do their own self-testing, to what some of those scores might mean. They don't have to have a treatment level of knowledge about diabetes. Matter of fact, that might even get in the way. But what they have to have is an understanding of it at a level where lifestyle intersects with that illness. That is, and knowing the importance for someone with diabetes to do their self-testing on a regular basis, to know what an A1C score is. And so when their client speaks about a change, they know how to appropriately respond. You know, so it's more along that line. We're still going to be doing a lot of the same coaching, no matter what the chronic illness or the health challenge. But there are definitely some things there where a little deeper knowledge is important. Mm-hmm.
And following up on this, Michael, do you think that a health and wellness coach that is going to work with chronic disease patients should have his graduation, his background in the health field or not? Because this is a question I always receive here, and
Right.
It's a debate, and I know we have something to tell about this. So.
Now, it's really not necessary. The healthcare background can be helpful, but when the coach really stays with the coaching aspect of it, here's the distinction that I like to make that's very simple. The treatment team, the nutritionist, the dietitian, the physiotherapist, all of these people tell people what they need to do. The job of the coach is to help them with how am I going to do that in my life. I've been told that I need to manage my stress better, get more sleep, quit smoking, lose weight. Well, that's the lifestyle prescription, we call it. And the treatment team has told them this. And they know that they should do these things. But the hard part is, how do I do it? How do I succeed at it? And very importantly, how do I maintain it? How do I make it last? And see, those are the kinds of skills that the health and wellness coach should really be good at.
Yeah, just to add briefly to what Michael said, as coming in as a health and wellness coach, you assume that the client is an expert in his or her own life, right? So, down to the nitty gritty details of, well, how in the world am I going to start walking 30 minutes a day? I don't have time in my day. So the coach really helps the client or the patient take a deep look at their life and, where can they actually succeed at fitting in the behavior change that's necessary in order to lead a healthier life.
Right.
Yeah. So we are getting to one other top 10 questions that we get, which is, how are we health coaches different from psychologists? So we are touching a bit on the positive psychology aspects of getting from the patient what he can do, how he can do, and the strengths he already have. Yet, how do we convey to others that we are not psychologists or therapists, but we do have this competence of promoting health behavior? It's a challenge. I see. Can you comment on that?
Yeah, I'd be happy to. You know, I am a psychologist and have been for many, many years. I did about, somewhere around 25 to 27 years of clinical type of work. And as I got into coaching, I saw the distinctions, the differences that are so important. Coaches definitely work with emotions. They definitely work with feelings. A coach that does not is probably not a very competent coach. But we also know the distinction between coaching and therapy. And that's a line that we really try to avoid crossing. You know, I like to say that a therapist, a psychologist, someone like that can go as deep as the person needs to go to explore feelings, to explore old wounds, to help heal old wounds, to change dysfunctional behavior patterns, to help someone with mental health issues such as depression or obsessive compulsive disorders or anything like that. Coaches do not do that. That is outside our scope of practice. And one of the things that we put together on the national board is a whole statement about scope of practice. And that's true for whether it's mental health or nutrition or anything else. We stay within our licensed fields. And when it comes to coaching versus therapy, you know, there's a lot of overlap. There's a lot of similarities. We're still looking at behavior change, okay? And, you know, changing behavior is the name of the game in psychology, right? So we're drawing upon a lot of psychological theories developed by psychologists, such as the trans-theoretical model of change, the readiness for change theory developed by James Prochaska, self-determination theory by Dietschy and Ryan, and so forth and so on. We're building on that how to change behavior basis, but we're not doing it in a therapeutic, healing kind of way. That's the realm of the psychologist, the mental health professional.
Michael, can I don't know, think with you for a moment? One of the programs I'm coach here is a stress management coaching program inside a hospital facility for the employees. Mm-hmm. And I'm in the hospital with the multidisciplinary team. So I have physicians working with me, a psychologist, so I can discuss the cases and everything. They have the support. And great. What is happening a lot is that I receive for coaching healthcare professionals that are doing mental treatments. So they are doing psychotherapy, they are medicated by a psychiatric. So it's a full role of offer, so you can care for this person. And what I say many times here is that if the person is depressed or has another illness in mental health and it's well treated, yes, I can do the coaching process. And this is going to collaborate on the healing on the process. But if the person is not in treatment, usually I don't accept as a client because I feel a kind of negligence of my part if this person doesn't have the full care that she needs or he needs. So would you like to comment a little on this? Because this is a strategy that I organized and that I used to teach my students also. Yeah. And I would very much like to hear from you.
Yeah, that's very important to make those distinctions. Just like we would not try to coach someone who has severe heart disease, who was not under medical treatment. You know, for example, I worked with a student of mine who I was mentoring, and she was coaching a man who was a very big man who was very much overweight, and he had heart problems in the past, but he didn't want to see a doctor. He just wanted to work with a coach. So the two of them put together a walking program. And while he was out on the walk, he had a heart attack.
Perfect. Yeah.
Now, she was very lucky because he was not the kind of person that would take you to court and, you know, bring up a lawsuit. But she could have been vulnerable, you know, because they had constructed the walking program together with no medical clearance. So likewise, on a mental health issue, if it is a diagnosable mental health issue, like we're saying, you know, depression is extremely common at a clinical level, or some other kind of mental health issue. It would be real important for them to have mental health treatment. Now, mental health patients really often tremendously benefit from health and wellness coaching. Their statistics for, lifestyle-related illnesses are much worse than for the general public. And you can work with someone as long as they are seeing their treatment professional. A great thing for the coach to say is, when the person starts to bring up therapy issues, is, oh, that would be a great thing to talk to your therapist about. Have you talked to your therapist about that? Instead of me?
I think Michael brings up a good point too, in that, health and wellness coaches are trained and should really understand our scope of practice so that we know when to say, this is something that needs to go to your psychiatrist or psychologist or primary care physician, or to be brave enough to say, this really is outside my scope of practice, and to feel that you have the right to say that.
Mm-hmm. And sometimes that will come up when a person is exploring doing coaching with you. They'll bring up an issue that is really outside of what coaching was ever designed to do. For example, I had a woman give me a call one time and say, I heard you're a really great coach. I want to work with you. Me and my boyfriend both want to work with you. We're both very active alcoholics, and he physically abuses me, and we want to work on that in coaching. And right away, I said, that's really not what I do as a coach. That's not what coaching is designed to do. And I was able to give her the names and numbers of 3 different therapists in town that they could actually go see. Many other times, it doesn't come up until later on in coaching. Coaching is already underway, and then the person starts to trust you enough to start talking about what's really, bothering them. And they may bring up an issue about abuse or some kind of really serious, perhaps drug issue or something. And that's where we want to be able to make a referral and do it well, but also not abandon the person. Help them see their way through to complete the referral. That's also real important. Mm-hmm. And perhaps we can continue to coach them, or we may need to have them just work with a mental health professional.
Yeah, I think it is an issue with other scenarios besides mental disease. Mm-hmm. As well. Health coaches are commonly looked for as a source of help for losing weight, for example. And a lot of times that fits into the label of a chronic disease. So I've worked with individual patients, but also in a team with an endocrinologist and a nutritionist and the coach. And that's for sure the better formula, where you have, the diagnosis of a metabolic syndrome, the nutritionist to provide the guidelines and educate the patient on what to do, and then the health coach to make it happen. But a lot of times this is not the scenario. We have the MDs, sometimes the nutritionists, and 3 months later the person comes back with no change at all. So we have seen MDs and nutritionists as well, and other health professionals looking for health coaching training. And so my question is, do these now licensed professionals with health coaching training replace the need for health coaches as they get the understanding of the coaching process and the competences? Or do we still have a niche for the health coach professional, who's not an MD or a psychologist or a nutritionist? I would like to hear you both on that.
Yeah, so this is a really great question, and it's actually a conversation I have with a lot of physicians. So here in America, at least, the average time that a physician can spend with a patient, depending on the healthcare organization that they work for, is somewhere between 6 to 20 minutes, right? So that's not necessarily enough time to actually have the type of conversation that they would like to have with their patient. So even if a physician were to become certified as a health and wellness coach, or go through, a program, I think there's a lot of benefit in that, right? Because it changes their language and how they actually approach their patient. However, at least in our current healthcare system and the way it's designed, I think that it's much more practical for a physician to actually be able to then refer to a health and wellness coach that has the actual time to have those deeper conversations about how are you going to change your behavior? What is your intrinsic motivation? Why is this important to you? Right. So I definitely think there is a need. And I say that only based on my conversations with physicians. Michael, you probably have more to add with other professions within healthcare.
No. Well, yeah, Leanne is, really bringing up something that's so important, the amount of time spent. And think of it this way. If you are the chief financial officer of a healthcare organization, and you have a physician who gets paid hundreds of thousands of dollars a year, or, how many, is it real in Brazil? How much are they getting paid compared to a coach, who maybe has a 4-year degree, maybe a master's degree or something like that? They're going to be paid a lot less. So it's more efficient to spend more time with that person who's being paid less. And the practicality of behavior change, it takes time. It takes support. It takes implementing a wellness plan. It takes accountability. All the steps and details that the physician doesn't have time to do. Most of the physicians that we have trained have changed their practice where they're not practicing full-time as a physician anymore. They are working part-time as a physician, or they are practicing in such a way that they can spend a lot of time with their clients and they see fewer clients. The physician that works in a busy healthcare system, like Leanne is talking about, does have 6 to 20 minutes, and that's it. And it's see the next patient. I mean, they're under a tremendous amount of stress. So, I think there's always going to be a role for the health and wellness coach. I think we're starting to recognize there's a greater role, because what we keep seeing is, like I was saying before, people are told what to do, but they struggle with success at maintaining health behavior. And that's where programs and communities and workplaces have to do more than just offer coaching. They have to offer health promotion programs, wellness programs that are holistic, that are very comprehensive. And that's going to give people the best chance to succeed in the long run.
Thank you. I just wanted to wrap up, Danny, and I'll pass it on to you. I think Leanne touched on a very important point that it was almost what I wanted to hear, which is as MDs and other professionals get trained in health coaching, they speak the same language and they understand the process. And that makes a whole difference in this interdisciplinary work, which is where we work our best, taking care of that patient with the focus on the patient. And so that is the language makes a difference, and I'm glad to hear from you, Michael, that there is a role for health coaching, even though doctors and other professionals get trained, because the day-to-day work takes time. And I just wanted to add that you mentioned the word holistic, and I like that because I work with integrative medicine. And so I work with an MD who is trained in integrative medicine in the US. And even with the holistic view focused on the patient, she still relies on a health coach like me or others to do the behavior change promotion job. So I'm glad to hear that. Danny.
While you were talking about the physicians, I got curious about the lifestyle medicine movement that I know this is getting stronger in US and it's getting stronger here also, it's getting bigger. And I teach in a post-graduation training here in Brazil that trains physicians in lifestyle medicine, and I do the health coaching part. And it's amazing to see how they change during the training, during the year, as long as they are getting in touch with the knowledge of patient-centered approach, and they are beginning to look to themselves also as a process. So maybe you could comment a little on this lifestyle medicine movement. How is this happening in US? And what kind of integration or in the training or composition teams, or, you know, because I see physicians in Brazil doing what you said, Michael, they are having half of their time seeing patients and half of their time doing lifestyle medicine programs. So they organize 12 sessions on smoking, 12 sessions on physical activity, and they work with groups. This is starting to grow here. So how is this movement in US?
Well, the lifestyle medicine field has just exploded. It's been really amazing. I'm a member of the American College of Lifestyle Medicine, and I've been to their conference and presented at their conference a number of times. And one of your other presenters, Margaret Moore, has also presented there a number of times also. And really, I would say it was she and I that really brought a lot of health and wellness coaching into that organization and helped them see the value of it. And really help them to see how behavioral health really is. And that's really what's exciting to see. The field is growing tremendously. Their conference that they were doing up until this last year had doubled in size every year. And just a tremendous response to this whole notion of using, lifestyle change as a first line of therapy. I mean, one of the things that's very exciting is the American College of Lifestyle Medicine has now put out a position statement saying that the goal of the treatment of diabetes should be complete reversal, not just maintenance. And that's real exciting because what reversal involves is tremendous lifestyle change. And to succeed at that, people really need help. They really need support. And that's where coaches can play a very valuable role. So lifestyle medicine's really grown tremendously. It's also growing around the world. I got to present at Lifestyle Medicine Asia in the Philippines, and it's very exciting to see what's happening there. I've also seen, health and wellness coaching growing in China. I've done 6 different trainings there. It's growing in Europe, and there's interest in the Middle East, and as well as Australia, other countries, and continued interest by all of you in South America. Yeah. What would you add to that, Leanne? I mean, you've been in touch with lifestyle medicine people a lot too.
I am. Yeah, I think you really hit it. The only thing I would add is, which you spoke about, was just the tremendous growth that I've seen. The American College of Lifestyle Medicine has a great leadership team, and they are really working hard to grow the entire field, but also to make sure that the role of the coach is very much integrated onto that healthcare team. And just to give you an example of the growth, they said they wanted to start a health coach interest group. And I said, oh, that will not be a problem. And I think they might have questioned it. And within a few months, we had well over 100 members. It's a very, very active group within the American College of Lifestyle Medicine. And it's really a great opportunity for physicians to really understand the role of the health and wellness coach. And the other thing that I've seen is, as ACLM grows, there are more and more physicians who are coming to them asking about what exactly it is that they do and how can they get involved. So definitely one of my most favorite conferences of the year.
Oh, yeah, same here. Yeah. Yeah, one of the things that really got me excited even several years ago was my company, Real Balance, had a booth at the conference, and these physicians would come up and nobody was asking, does health and wellness coaching really work? Nobody asked that. Instead, they were all asking, how can we bring this into our place? How can we integrate this where we work? They were already sold on the idea.
Yeah, I feel just the same here. It's growing so fast and they are so enthusiastic. So it's great. So I think we're coming to an end, right, in time. And I would like you to give a final word to us, maybe addressing what would be our first step now to strengthen the market here for us, to have space for more people work with this. That's my personal struggle now. I want to have jobs for everybody I trained. So
yeah, if I could back it up a few years, I think one thing that I would do more of is outreach and marketing and education, right? So truly creating an understanding around what is a health and wellness coach, how can they benefit you, and how can they become a part of your team. So just creating that really specific understanding of the role of a health and wellness coach.
Mm-hmm. Yeah, I think a big challenge for a health and wellness coach that works independently is attracting enough clients.
Mm-hmm.
And I think the main strategy that they have to use is to think about, how can I create alliances with organizations that can provide clients to me? I think it's very difficult for the health and wellness coach to just say to the entire general public, hey, I'm here and I can help. I think the general public still does not understand the value of a health and wellness coach enough yet. It's very similar to a massage therapist maybe 20 years ago, where the general public didn't really understand all the benefits of massage and the therapeutic aspects of it. And so, there wasn't as much business for a massage therapist. Now, people really do understand it. They really do value it. And so the general public engages in it more. Eventually, we will get to the point where that will be the case with health and wellness coaching. But for right now, the entrepreneurial, independent health and wellness coach has to put themselves out there in many different ways and get creative, offer group coaching, specialize maybe in some particular challenges that people have, and really connect with different organizations that they can create alliances with. I think that's really going to have to be that combined strategy that's going to help them succeed.
And I'd like to add, oh, sorry.
Yeah.
I just wanted to add one more thing, which is I know the focus today has been, healthcare, coaching in healthcare. However, what I'm really starting to see is health coaching growing in other areas, right? So, for example, the school systems, right? So I'm really starting to see a lot of coaching happening with children and families. And there's a lot of like school or education systems that are reaching out to us to learn more. The other area that I'm seeing growth is the self-insured organizations, right? So there's a real benefit to large organizations. We'll use Walmart as an example. Self-insured large companies who will benefit by bringing in health and wellness coaches to work with their employees, because if they have healthier employees, everything runs smoother. It's all better. So I think just thinking in terms of health and wellness coaching in healthcare, but also where else can people benefit?
Yeah, actually, Leanne, when you say that it's really, healthcare is sort of the new frontier, and the smallest percentage of coaches are working in healthcare directly. It's actually a very small percentage. I would say the vast majority right now that we see in the United States are working for, disease management companies, insurance companies, corporate wellness programs like Leanne is talking about, where that company is providing a wellness program, but they've realized they have to do more than just educate, that they have to help people actually, have that one-on-one connection, have that wellness plan that's customized that can really help them succeed and, benefit as a whole company because of it.
Yep, exactly.
Yeah, I have to say I'm thrilled to hear Leanne talk about health coaching for children, because on my other hat, I am a researcher and I work with children and health promotion, and we know so much about preventing chronic disease in the adulthood if we treat the children, or if we work with their vulnerabilities and their habits. It's fantastic to use health coaching to change the stigma, and even before reaching the point of reversing diabetes, we could prevent it if we work with children. So that's great to hear that it's already another door opened for us.
Definitely.
Thank you. This has been wonderful. Dani?
I just don't know how to say thank you anymore, because you are so generous, and it was great to talk to you, and it was great to have your presence here with us, and to offer generously these videos recording for many people to listen after the event, because it's going to be open. So thank you so much for being with us. Thank you so much. I don't have anything else to say. I'm just too grateful. Yeah.
Oh, it was my pleasure. Thank you for having me.
Yeah, we're really grateful for the opportunity to reach more people in Brazil with, health and wellness coaching, and how we can really make it be successful for the people doing the coaching and the people that they serve.
Yeah.
Great.
Thank you.
Thank you.
Thank you so much. We hope to have you in the future to show all the success that we are discussing here.
Yeah.
So I'm stopping the